I received a really nice question in a comment the other day, and it asked about whether one should work in mental health if they are conflict avoidant. Now, I love these kind of questions. They really make you think. And it's certainly been something that's quite personal to me. I've felt quite a journey around the concept of conflict avoidance and how it's played into my practice. And, personally, I was a bit shocked at how little I was aware of it as an issue. So I read that comment and it struck me, and I felt like this is an important concept to talk about. It certainly isn't commonly discussed, and so that's what this video is about. It's about talking about conflict avoidance and how that interplays with whether one should work in mental health care. For those of you who are new here, by the way, my name is Dr Syl. I'm a junior doctor in Australia, and I'm on a psychiatry training pathway. So I'm not a psychiatrist, but I'm in the training program to be a psychiatrist. I am a doctor. And none of this is medical advice. I'm not representing any college or workplace, and I do these videos in my own personal capacity. And I think that's it for the disclaimer. Let's crack on. I think the first thing to say is that you absolutely can work in mental health, in psychiatry, if you're conflict avoidant. It's not about being a perfect human when you're going into mental health treatment or mental health care. It's about being a reflective human, understanding what makes you human, what makes you imperfect, understanding how that affects your interactions, how it influences what you choose to focus on, what you choose to avoid, because no one is perfect. And if all that ever existed was perfect psychiatrists, well, you'd have that's a lot. That's just never going to happen, right? All psychiatrists are human. Everyone who works in mental health are human. We all have our flaws, and the biggest flaw one can have is a lack of self-awareness of their flaws. Now, the nature of psychiatry, of even psychology, and a lot of other mental health roles is such that you will have difficult interactions with clients and there will be conflict. The priority in every review that I enter, the first goal is always to establish safety, security in the connection, interpersonal connection. I try and establish a sense of trust that I'm in the room with the goal of helping that person, and that is what rapport is. Rapport is empathy reciprocated. So it's me going into the room, understanding what the patient is going through, at least to an intellectual level and hopefully to a deeper level than that, and the patient understanding why I'm in the room, what my role is, what I'm trying to do, and why I'm trying to help. That's very important and not necessarily sufficient in treatment. There are plenty of examples where the rapport, the connection, the relationship between a professional and a client is good, and it helps, and it's important, and it's critical, and it's the most important part of that person's treatment. But the inverse is also true. There are plenty of examples where there is no rapport, no connection, even anger between a therapist, a psychiatrist and patient, but still there is a positive clinical outcome in the interaction because the person needs something they might not have insight into, and that generates a conflict. We're kind of coming back to the question now, which is, if you're conflict avoidant, can you work in psychiatry? So it's inevitable. You're going to have conflict. And the goal is understanding why you're conflict avoidant and what does that really mean, okay? There's a million reasons why someone might be conflict avoidant. You know, were you from a big family where there's lots of kids, no space to be upset? You know, you got to be in a good mood. You got to, be positive. Don't get into a fight. Put a smile on your face, that kind of thing. Or were you did you experience a traumatic experience where you were unsafe and interpersonal conflict throws you back there? Is it, there's a million reasons. I could go through many examples of how one develops the sense of conflict avoidance. I'd say most people are conflict avoidant, right? We all wish to conform, and that's got an evolutionary basis to it. So it's very genetic and evolutionary and protective overall. But the extent and mechanism by which you are conflict avoidant can be problematic. If you are too conflict avoidant, that you avoid people, that you feel too judged, that you have a social anxiety, that you can't attend work, you can't do an exam, obviously that's going to cause major issues, and that needs to be processed in therapy and treated if it's a disorder first. And that would be a barrier to progressing through medicine and psychiatry. But if it's not to the point of it being considered, a disorder or so severe that it's disabling your interactions with people, then it's really about understanding how it happens, why it's happened, and how you manage it and what you can do to manage it. I think at this point I should generate my own personal reflection, because I definitely was conflict avoidant. I still am to a point, but I'm more aware of it now. And when I started as a registrar in psychiatry, I was pretty unaware of it. And for me, the mechanism was really around a couple of things. First, I think I had the image in my mind of being this savior, of wanting to rescue people, being the one that pulls them out of their dark place, kind of wanted to be the one that they felt understood by, and yeah, it's really this kind of savior complex that I had. And I remember as a junior registrar seeing a patient who was experiencing what's called the delusional parasitosis. And in hindsight, it was very clear that that's what it was. But I was too sensitive, and I didn't want to generate conflict. I didn't want to disagree with him. I wanted to believe what he was saying so bad so that I didn't get into a conflict with him. And I don't want to be too specific in the account, but it was along the lines of bugs crawling in and out of my skin, look into my ears. If you can't see them, they're hiding, and they come back out when you don't look, and they're itchy, itchy, itchy. And to avoid conflict with this person, I suggested to do voluntary treatment, because this person did not think they had a mental illness. They did not think they needed any treatment. They actually went into hospital because of the itch associated with this thing called delusional parasitosis, which, if you think about the word, it's a false belief of parasites under the skin, right? And causes people to scratch and rip their skin up and stuff. So I really tried hard to make a voluntary plan with this gentleman to try and convince him to take a medicine that he did not want to take, and that he did not end up taking. And a consultant later who had to put this person on an involuntary treatment order, helped me realize that the conflict I should have had, right? I should have disagreed with him because I knew the diagnosis. I knew he wasn't going to take the medicine, and there was risks associated with keeping him voluntary because he could have just left at any time. But fortunately, he received the right treatment. But the conflict I should have had was in his favor. It was what is best for him. That does sound paternalistic, but when people have a mental illness and do not have insight into what's happening in them, the judgment is then deferred onto psychiatrists and multiple doctors. It's never just one doctor that does this paternalistic approach. We get multiple reviews, and then that's when we can justify the involuntary treatment. So I tried the voluntary approach. He didn't take my medicine, and all that was just because I really didn't want to have a conflict with that patient. So that was my first experience of realizing that conflict can actually be very helpful for patients. And since then, there's been countless times of people who come in with a severe mania or psychosis who have no insight into their risks. And I've had to have difficult conversations which are a conflict in nature, and explain to them the plan for them receiving treatments they don't want. And I'm quite comfortable with the ethics of that and my duty in that. Because in psychiatry, interestingly, your duty is not just to a patient, it's to society as well. It's my dual role is it's a doctor to the patient, but also as in a way, I'm trying to think of a better word than protector, but I serve society as well. So now, when there is conflict, or I anticipate conflict, I really try and use mindfulness techniques. It's funny, I had done a 10-day silent Vipassana meditation retreat years ago, and hadn't really meditated since, but it was 10 days non-stop, 14 hours a day of meditating at least, and it was all silent for 10 days, which if you know how much I like to talk, you can imagine. But it was a very important experience for me, and I did learn the importance of mindfulness and breath work and body scanning. And so when I do feel conflict arising, I try and always remain polite, human, understanding, but firm, right? It's important to remain firm, especially if it's a very important and, clean plan. And it's also very important to be clear. So I notice in my body, and so I try and slow my breathing down when I feel a patient getting angry with me and me feeling upset. I just slow my breathing down. I notice what's happening in my body. I notice what's happening with them. And I always try and remember this is their emotions. Okay, let their emotions belong to them, and let it wash over me, because I do feel it, and I just try and imagine, I'm like a duck and the emotions wash over me. Or sometimes I imagine, and I hope this isn't exposing me as like inhumane, but I try and imagine that, like, if someone's insulting me and shooting insults at me, I imagine I have a little lightsaber in my head and I'm cutting the insults in half as they hit me. It's quite embarrassing to reveal, but whatever kind of strategies work, right? There's no rules, and that works fine for me. Obviously, the priority is in the patient not feeling belittled, and that's the role of that is to protect myself, not to belittle what someone is saying. And if someone is, if you're in a conflict and a patient's angry with you and they're shooting off insults and things, then it's about conflict, management. And depending on the risk of the patient, you might be with multiple staff, you might be in a big room, you might be quite distant. In psychiatry, you learn about diffusion and verbal de-escalation and risk management and things like that. So then you go to those kind of practices. So now coming back to whether one should work in psychiatry if they are conflict avoidant. I guess to kind of conclude my rambling, you absolutely can. Most people are conflict avoidant and agreeable, and you just have to learn that A, conflict is necessary. B, since it's necessary, you need to learn how to manage it in yourself and how it influences your practice. What areas of the reviews are you avoiding? Are you not asking about childhood because you had a difficult childhood? Are you not asking about drugs because you've got experience, you've got a personal bias away from that? You just have to be aware of your biases or something like, self-awareness is just key. And that's why we do supervision. That's why we get observed from our supervisors. That's why it's important for people who do psychiatry to do their own psychotherapy as a patient, which I plan to do. I haven't started that yet, but 2026 is going to be the psychotherapy year. So it's self-awareness is really important. And at the core of the question, the most important thing to remember is that nobody is perfect, and conflict affects it, 99% of people. So it's about understanding the process, what's happening in you. And for me, if I'm able to just kind of control my breathing and check in with my body, use my little lightsaber trick, then it works pretty well. I also find that if you're with good staff around you, Like, you shouldn't go into a review alone if you're anticipating conflict. You should always be with multiple staff. And if you're with good staff, then that kind of creates a dynamic of safety as well. So I hope that answered your question. Yeah, I think we all have our own coping mechanisms of stress. Conflict is stress. It's just about knowing what your coping mechanisms are. Please be aware that plenty of them are unconscious. We all have unconscious mechanisms at play, me included, right? And I've already talked about some of my narcissistic defenses, my need to save, my need for approval, and all those kind of vulnerabilities of mine. But being aware of them is what's important. So me now being aware that I have a drive to get someone's approval, I can see that and recognize when it's at play so that I can avoid using it, because it's not a healthy or adaptive thing in a psychiatric review. And that will, I expect, make you a better psychiatrist. All right, guys, I'll leave it there. I'll see you all in the next video. Bye for now.